السلام عليكم ورحمة الله وبركاته وإن شاء الله يكون الجميع بألف خير وصحة وسلامة. Today we will be talking about infertility. The objectives of our lecture will be to understand the definition of infertility and its causes, and to know the initial steps for evaluation of infertile couple. Also to explain the processes and the procedures involved in assisted reproductive technology واللي تختصر بالART and to describe their complications. طبعا لازم نقول فد ملاحظة مهمة، احنا لو قدمنا هذا الموضوع ب10 محاضرات ما راح يكفي، لأنه هو الآن أصبح علم قائم بحد ذاته وأصبح يعامل كسب سبيشاليتي ضمن الجاينيكولوجي. What is infertility? It is the inability of a couple of reproductive age to achieve conception after 1 year of sexual intercourse without contraception. ممكن infertility تكون primary, it occurs without any prior pregnancy, or secondary, that occurs after a previous pregnancy. There are important terms and definitions. Infertility is the lack of fertility مثل ما قلنا after 1 year of frequent attempts. Subfertility is decrease but not absence of fertility. Sterility is complete inability to achieve fertility. Fecundity, the probability of achieving a live birth in one menstrual cycle. هذه المصطلحات طبعا ممكن تمر عليكم من تقرون papers, review articles، لذلك مهم أن نفتهم معانيها. In those attempting conception, approximately 50% of women they will be pregnant in 3 months, 75% in 6 months, and more than 85% they will be pregnant by 1 year. طبعا هاي المعلومة مهمة بحياتنا لنفسنا والأقربائنا. مو يعني انه مجرد ما حدث الزواج لازم يحصل حمل، لا، لانه the pregnancy rate it is cumulative، يزيد بزيادة المدة. Most couples are more correctly considered to be subfertile. It is generally agreed that an infertility evaluation should be considered in a couple that has failed to conceive in 1 year. The evaluation, it can be performed in any woman older than 40 years at 6 months, and according to some experts in women older than 35 years. يعني ما نستعجل على المارد كابل ونخبصهم بالفحوصات والتحاليل، نعطيهم وقتهم وبعدين نبدي الايفالويشن، الا اذا كانت الwomen 40 years and more، وللبعض 35 years، لأنه مثل ما راح نشوف بعدين أنه fertility rate for the female decrease with increasing age. The natural fertility is affected by many factors. Age, smoking decrease the fertility in both the female and the sperm quality in the male. Alcohol, using drugs, some drugs, for example, having chemotherapy, some drugs of hypertension, body weight, when it is either severely underweight or obesity. Occupational hazards, like those who are exposed to excessive heat, which can affect the sperms. Coital frequency. Stress and anxiety may affect the coital frequency, and for those who are trying to achieve a pregnancy, we advise that the coital frequency to be 2 to 3 times per week. Therefore, when we face a couple trying to achieve a pregnancy, we should optimize the health before conception. We give conception folic acid at a dose of 400 microgram. We offer the female rubella screening, okay, so that if she hasn't got immunity to rubella, we can offer the vaccination prior to attempting pregnancy. هذا الجدول أول ما تشوفوا يعني يمكن تستصعبوا، لكن هو بالحقيقة هو ملخص لكل الكلام اللي راح نتكلم عنه لاحقا بالمحاضرة. يبين لنا إذا تشوفون الفيرست column هو the known causes of infertility, and then the diagnostic test and the procedure, treatment options, and comments. For example, first, when we talk about male factor, which represents about 20 to 40%, which is approximately 1/3 of the cases of infertility. And therefore, we shouldn't start by investigating the female, exposing her to so much stress prior to evaluation of the male factor. Male factor can be evaluated by semen analysis, and the treatment options will be intrauterine insemination and others. Female factors اللي هي تتقسم إلى ovulation problems, anatomical factors, peritoneal problems like adhesions and endometriosis, cervical mucus problems. We will talk about each one of them in the next slides. And finally, unexplained infertility, which represent about 10 to 15%. Also, you will notice this during the lecture. The initial evaluation of an infertile couple starts by history. We should check the age, if there were previous pregnancy, how long they have been trying. For example, if they tell you 2 months of marriage, we reassure them, we give folic, we give advice about coital frequency, okay, and we can postpone the intervention if there is history of dyspareunia or impotence. Few points about the male history. If there are pregnancies achieved from other marriages, testicular surgery or injury, radiation or chemotherapy, خصوصا وإنه الآن there are so many survivals of childhood malignancy. If there is a chronic illnesses like diabetes, وخلي بالنا إنه بعض illnesses they can affect the fertility by themselves or by the drug that are used for these, the drugs that are used for these diseases. Regarding the female, there are specific points. We will review the visual history. We will assess if there is previous pelvic surgery or infection, appendicitis. This can lead to adhesion, which can affect the tubal patency. If there is history of leiomyoma, if there is recurrent cervicitis. And then we will go to examination regarding the female. We will assess the height and weight body mass index, fat and hair distribution, and acne, which can suggest polycystic ovary, for example. We look for features of thyroid disease if there is any abdominal mass, and then we go for vaginal examination to assess for infection, the uterus size, and mobility. The male examination, and of course we send the male for a urological surgery colleague who will evaluate him better than us. For us, we'll check the height, weight, and body mass index, and the colleagues will check for gynecomastia, if there's inguinal hernia, inguinal mass, checking of the testicular volume, if there's evidence of varicocele, and if there is penile abnormality. After we have taken history and examination, we will start to investigate the couple. We will do this, first of all, seminal fluid analysis. أريدكم تنتبهون إلى ملاحظة أسفل هذا الجدول. The data were generated from semen parameters of fertile men whose partners achieved a pregnancy within 12 months. يعني أخذوا عينة من الرجال زوجاتهم حققوا الحمل خلال 12 شهر اللي بعدها احنا we start evaluation وتم اعتبار الفاليوز اللي موجودة على الفيفث centile that they are abnormal. فيعني seminal fluid volume should be more than 1.5. The concentration more than 15 million per milliliter of the ejaculate. Total sperm, okay, should be more than 39 million. هذا احنا بالايجاكوليت كله يقصدون. التوتال موتيليتي it is 40%. وحط لكم ملاحظه من نقول total motility it means the progressive and non-progressive sperms لانه السبرمز ممكن حركه تكون متقدمه ممكن تتحرك لكن لا تتقدم. اوكي normal forms of sperms لازم تكون اكثر من 4%. نجي على الايفالويشن فور ovulatory factor. شو عرفنا صار اكو ovulation ممكن نسوي مثل luteal phase serum progesterone لانه احنا نعرف بعد ان يحدث ovulation يبدا الريليس اوف progesterone فاذا كان اكثر من 30 نانومول بير لتر then it is a diagnostic of ovulation وهذا لا يعني حدوث الحمل هذا يعني وجود ovulation. In the markets there are available commercially LH detection kits. Physiologically, if you remember, there is an LH search which occur prior to ovulation, and this can help the couple to time the intercourse. By ultrasound, we can check the ovaries for features of polycystic ovaries, and if you find during your examination anything that suggests thyroid disorder, then you should check for thyroid function test, and you may need a prolactin level. ممكن أنه تسمعون بالovarian reserve. The ovarian reserve is the remaining number of oocytes in the ovaries and it is directly proportional to the female reproductive potential. وهذا يقيم خصوصا في الفيميل اللي تذهب إلى assisted reproductive technology. It can be evaluated by anti-Mullerian hormone that is produced by the granulosa cells and it is not change in response to gonadotrophy. Second, it can be evaluated by antral follicle count واللي هو نفحص عن طريق الالتراساوند فإذا لقينا إنه الantral follicle count أقل من 4 we put in mind that there is the possibility of low response to ovarian stimulation. If they are more than 16, then there will be high response. How do you evaluate for tubal and peritoneal factor? We do extra hysterosalpingography وهسه إن شاء الله تشوفون يعني توضيح ما معنى hysterosalpingograph. We can do laparoscopy with the chromotubation يعني يديروا لك laparoscopy تدفع داي من السيرفكس اللي إذا كانت التيوبز open راح نشوف الداي تظهر بالperitoneal cavity through the fimbrial end of the tube. Hysterosalpingocontrast sonography إنه يدفع contrast media بالسيرفكس ويفحص باستخدام السونار. Evaluation of the uterine factor, it can be done by ultrasound, by hysterosalpingography, where in the uterine cavity it can be evaluated. If you look here, sorry, in this diagram, you see a special catheter is put inside the uterus, the dye is pushed so that we can get this view. The uterine cavity is clear and the fallopian tubes are open. While in this film for hysterosalpingogram, one of the tubes seems to be blocked. Now, how are we going to treat infertility? Of course, we will direct our treatment to the cause. If we have a problem in ovulation, we will start to do ovulation induction. بما معناه إنه إحنا راح نستخدم أدوية علاجات قد تكون جراحية الغاية من عندها أنه نحفز الفوليكل أنه تكبر بحيث توصل إلى حجم الماتشور جرافيان فوليكل. First, we can use clomiphene citrate. It is very commonly used. It is non-steroidal agent that demonstrate both estrogenic and non-estrogenic properties. يفيدنا إنه الclomiphene citrate block the estradiol receptors. As a result, there will be feedback to the hypothalamus so that the gonadotropin releasing hormone it will be improved and eventually there will be an increment in the FSH that will drive the ovarian follicle activity. It is administered orally, typically starting from the 2nd to the 6th day, that is to say only 5 days in a cycle. The exogenous gonadotropins. Here, gonadotropins, you know, they are the FSH and the LH. First of all, you should remember your physiology. The FSH and LH come from the pituitary, go to stimulate the ovary. Here we are using gonadotrophins. Either previously were prepared from the urine of the postmenopausal women. لأنه احنا بالpost-menopause, when the ovary stops working, the FSH and LH will be increased. Or they now we can get the gonadotrophins from recombinant technology. So if you want to use the gonadotrophin to stimulate or to induce ovulation, then it can be given IM or subcut in early follicular phase, and we should follow by ultrasound to check the number of follicles that will be developed, because we don't want more than 3 follicles. In this case, we will withhold, we stop our cycle. يعني احنا نجي وننطي gonadotrophin على امل انه we push some follicles للماتوريتي. ما غير صحيح انه احنا يصير عندي مثلا 10 follicles، لانه هذا ممكن يعرض المرأة لخطر اسمه الاوفريان هايبرستيميليشن سيندروم اللي راح نحكي عليه. طبعا انتم لازم تخلون بالكم احنا الاف اس اتش يكبر لنا الفوليكل، بعدين يجينا ال اتش تريجر بالاوفيوليشن از اندكشن نستخدم الهيومن كولونيك gonadotrophin to achieve the final maturation and to trigger ovulation، لانهم ال HCG وال LH they have similarity. من استخدمنا الfertility drugs, they can cause complications. One of them is the ovarian hyperstimulation syndrome. It is complex. It results from the ovarian enlargement. The symptoms can include abdominal pain, distension, ascites, respiratory complications, oliguria, hemoconcentration, and thromboembolism. وهذه صورة الأوفري which has developed ovarian hyperstimulation. تشوفون the numbers of follicle. Each one of them is a follicle. We don't want this. If we see more than 3 follicles, we should stop our cycle of induction. Why it occurs? Okay. Many theories they have been suggested to explain what happens, and one of them is the release of vascular endothelial growth factor, which increases the permeability of the blood vessel. إذا زادت permeability, then there will be loss of fluid, protein, and electrolytes into the peritoneal cavity. فإذا راح يصير عندنا third space. أول شيء من صار loss of the fluid, that will lead to hemoconcentration and increase the risk of thromboembolism. The hypercoagulability which occurs with ovarian hyperstimulation syndrome, it can be related either to the hyperviscosity following the hemoconcentration, or it may be secondary to the high estrogen level. What are the risk factors for ovarian hyperstimulation syndrome؟ يعني من نبدأ نسوي induction البيشنت نفسها لازم نتأكد هل عندها risk factors ولا لا، اللي هي multifollicular ovaries such as PCOS, young age, high estradiol levels, and when pregnancy occurs with our induction, there will be release of HCG. Well, HCG itself is regarded to be the trigger for ovarian hyperstimulation syndrome. The diagnosis is by the clinical features and the ultrasound, and we should put in mind that 5% of the cases are life-threatening. Okay. The other complication is multiple gestation. بعدين راح تفكرون شلون يعني هو complication. حلو التوين ما يخالف. التوين حلو, but any multiple pregnancy هو ممكن يكون twin, triplet, quadruplet, pentaplet. كل ما زاد number of the fetuses, the risk for miscarriage, the risk for preterm labor, the risk for disease to the mother like diabetes and preeclampsia, the need for surgical intervention will be increased, and therefore, in fact, it is regarded as a complication. The other Another method for induction, it is the laparoscopic ovarian drilling. In this method, we'll use the laparoscopy to create small holes in the ovary, and by this we will destroy some of the ovarian androgen producing tissue, and this will lead to a reduction of the peripheral conversion of androgens to estrogen, and eventually this will lead to the reduction in the level of androgen and LH and increment in FSH. This shows you in laparoscopy how ovarian drilling is done, okay, using diathermy. What if the anovulation is occurring due to hyperprolactinemia? In this case, we will use dopamine agonist, either using a bromocriptine, which is commercially known as parlodil, but it has so many side effects, and now mostly gabapentin is used, which is given twice weekly, and this will improve the compliance of the patient and reduce the side effects. When do we use surgical therapies? If there is prolactin secreting adenoma which is resistant to the medical therapy. What if we have hypogonadotrophic hypogonadism؟ ليش؟ لأنه احنا المحفز الرئيسي للأوفري هو قلنا الهايبوثالاموس بعدين البيتيوتري. فإذا كانت المشكلة هي بالهايبوثالاموس، إذا أنا أقدر أستخدم gonadotrophin releasing hormones أو أستخدم مباشرة gonadotropins. لكن إذا كانت المشكلة هي بالبيتيوتري معناتها I use directly gonadotrophins so that I can stimulate the ovaries. Treatment of tubal diseases. طبعا هذه تحتاج surgery. مثلا نسوي salpingo ovariolysis يعني ننفك adhesion fimbrial surgery, salpingoniostomy، نسوي فتحة جديدة للتيوب. لكن حاليا من نجي نقارن بين الكلفة للتيوبال سيرجري وكلفة IVF اللي in vitro fertilization، صار ميل أكثر إنه اللي عندها tubal disease تروح إنه تعمل مباشرة IVF، وراح يكون chance of achieving pregnancy is better. ليش؟ إنه إحنا حتى بنسوي tubal surgery مو شرط إنه we achieve pregnancy in 100% of the cases. طبعا هاي الكلام ايضا ينطبق على الاي في اف، يعني مو كل وحده تروح تسوي ان فيترو فيرتلايزيشن راح تحقق البريجنسي 100%. in fact it is not more than 23-25%. Okay, what if we have uterine or pelvic factors? The fibroids often asymptomatic. Myomectomy, in fact, it can be considered if there's significant distortion to the uterine cavity. The medical management of endometriosis, تعرفون من ننطق endometriosis, we are suppressing the ovaries, it does not enhance the fertility. But surgery may be helpful in cases of advanced disease or there's severe pain and a large ovarian cyst. Treatment of male infertility. It has many causes. The abnormalities, it may be aspermia اللي ماكو ejaculate, azoospermia انه there's no sperms in the ejaculate, oligospermia اللي قلة العدد, astenospermia خلل في الحركة, teratosospermia وجود حامل مشوهة أو ممكن تصير astenoteratosospermia. On ejaculation, it may be related to psychogenic factors or organic erectile dysfunction or impaired parasympathetic sacrospinal reflex. In the treatment, it will depend on the cause. In those men who are having retrograde ejaculation, we can administer oral pseudoephedrine or other alpha-adrenergic agents. And IUIs have been used to treat this condition by using the sperm process from voided post-ejaculatory urine. يعني إذا ما فاتت الدراجز ممكن يأخذون اليورين اللي بعد الإيجاكوليشن يطلعون من عنده السبرمز. In azoospermia, we can use testicular sperm extraction. In azoospermia, testicular sperm extraction, it may be performed, which is part of the ART, with intracytoplasmic sperm injection. In hypogonadotrophic hypogonadism, واللي هو مشابه للي يحدث بالفيميل، إذن الكوز هو central cause من الhypothalamus أو الpituitary, which is best treated by using gonadotrophin, FSH and SCG. In asthenospermia, expectant management may be considered, especially if the duration of the infertility is short. And we can use antioxidant therapy like vitamin E, C, with use of antibiotic in case of a presence of infection. In men with anti-sperm antibodies, systemic steroid they can be used. In men with varicocele, varicocele ligation is done for symptomatic patient. ونخلي بالنا هنا أنه الvaricocele is a very common condition in the male in areas with hot climate. فما يعني هذا أنه إحنا we need to treat every male with varicocele. And this has been shown by the fact that improvement in fertility following surgery is not confirmed. فإذن for those who are symptomatic, we do surgery. Unexplained infertility. In this condition, we will fail to reveal a cause in 10 to 15%. This does not indicate the absence of the cause, but in fact maybe it is the inability to identify it. يعني في حدود العلم الآن احنا ما وصلنا إلى السبب. IVF results have shown that there may be undiagnosed problems of oocyte or embryo quality or implantation of failure. يعني احنا فرضنا انه couple عندهم unexplained infertility، عرضنا عليهم بدأوا بالIVF، ممكن ويا الIVF نكتشف انه الكواليتي اوف امبريو او الاوسايت بيها مشكله. اوكي وهذه مو سهل طبعا يسهل diagnosis before IVF. The treatment options for a couple with unexplained infertility are conservative, and 60% they will achieve a pregnancy within 3 years, ovulation induction with or without intrauterine insemination, and IVF. Now we will talk about assisted reproduction. It is the facilitation of a natural conception by some form of scientific intervention. طبعا بالبداية كان هو ال IUI وال IVF بالتقدم والتطور أصبح لدينا الكثير من أنواع ال Assisted Reproduction، مختصراتها ال abbreviation موجودة وما هي أيضا مكتوب، يعني هذه ممكن أنه تصادفوها وأنتم تقرون paper أو article. كذلك مستقبلا اللي عنده interest ممكن أنهم goes deeper in studying about it. IVF, IUI, XZ واللي هو intracytoplasmic sperm injection، PGD, PGS، DOT، PROST والبقية أيضا اللي موجودين. Investigations prior to assisted conception، وبالحقيقة نفس ال evaluation for infertile couple، لأنه إحنا ما نقدر نحكم على infertile couple that they need ART، that إحنا مسوين good evaluation وفعلا قررنا أنه they need ART because it goes both emotional and financial cost to the patient، ولأنه أيضا success rate مو 100%. يعني احنا من نعرض ال IVF أو ال ART لازم we counsel the patient that the success rate is كذا percentage for each type of this intervention، وليس 100%، لأنه الناس يعتقدون أن أطفال الأنابيب هي نجاحها تام وما بها أي نسبة فشل. وال evaluation prior to this include hormonal profile، semen analysis, pelvic ultrasound, evaluation of uterine cavity and fallopian tube. وبالنسبة للميل طبعا يتسوى seminal fluid analysis، وممكن بعض الوحدات أيضا أصبحت تعرض sperm function test to choose the best techniques. We should, of course, optimize the couple health prior to ART. So we advise to stop smoking and to maintain a healthy body mass index. First, we will talk about the intrauterine insemination. It is simple. A prepared sample of the sperm يؤخذ من المale partner by ejaculation. Then a special cannula is introduced into the uterine cavity, and at appropriate time of the patient menstrual cycle, this sample of semen is pushed inside the uterine cavity, and after the IUI in 2 weeks a PT is performed. IUI can be done in a natural cycle، يعني ننتظر وقت ovulation للفيميل، أو إنه نعمل induction using Clomid or FSH. And we should monitor the size and the number of the follicles. And then HCG is given approximately 36 hours prior to the insemination to ensure the optimal time with ovulation. The advantages: it is relatively simple, it is not invasive as IVF مثل ما حتشوفون. It allows the fertilization to occur at the fallopian tube، لأنه بعض الناس ممكن يعترضون على ال IVF ويعتبروه غير مقبول دينيا. And disadvantages: the success rate it is lower than IVF. It is 5% for natural cycle ويزيد باستخدام الإندكشن. It requires at least one healthy tube. If failure occurs, then less information is obtained than if it was an IVF cycle. إذا كان المونيتورينج suboptimal طبعا راح تزيد complications مالت الاندكشن اللي هي multiple pregnancy ovarian hyperstimulation syndrome. The indications are unexplained infertility, mild male factor, ejaculatory problem, cervical problem, ovulatory disorders, mild endometriosis, and to optimize the use of donor sperm. The IVF it involves surgical removal of the mature oocyte from the ovary, fertilization by sperm in the laboratory. The first world successful IVF baby it was in 1978. The indications راح يكون for cases which are more severe than the more severe factors than the IUI. اللي هي severe tubal disease like tubal blockage, severe endometriosis, moderate male infertility, unexplained infertility في حال official IUI، وطبعا ال unsuccessful IUI بغض النظر عن السبب مالته. ال stages of IVF راح نشرحها في diagram. The IVF protocols are now categorized to 3 main groups. إما نستخدم natural cycle or long protocols using gonadotropin releasing hormone agonist, or short cycles using the gonadotropin releasing hormones antagonist. طبعا يجوز تفكرون احنا ليش نستخدم gonadotropin releasing hormones هنا. هذه تعطى حتى يعمل down regulation للبيتيوتري، وبعدها يبدي الاستيميليشن بالجونادوتروفين حتى يكون هناك more control على الاندكشن cycles. هنا نشوف هذا الدايجرام اللي يوضح لنا ال IVF راح يبدي by ovarian stimulation and monitoring. يصير عندنا عدد محدد من الفوليكلز، يعطى HCG طبعا، بس ما ننتظر مثل ما انتظرنا بالIUI. ليش؟ لأنه احنا ما نريد يحصل الأوفيوليشن الناتشرال وتروح علينا الفوليكلز. بعدها يتم الإيج كولكشن والسيديشن. عادة يكون هذا الجمع عن طريق transvaginal route with ultrasound guide، وفي بعض الحالات قد نحتاج إلى لابراسكوب. بعد ذلك يحدث insemination اللي هو أنه نخلي الفوليكلز مع السبرمز اللي تحصلت بالجمع من الهازبند، وممكن مو انسيمينيشن عادي، اكزي. الاكزي هسه نحكي عليه اللي هو مو مجرد انه تمزج الفوليكلز مع السبيرمز، لا، هنا الاكزي راح يدفع السبرم الى داخل الفوليكل، ثم تتابع الزايجوت اللي نتجت عندنا، ونشوف الديفيجنز. وهنا طبعا راح يجي دور الامبريولوجيست اللي راح يراقب ويشوف which embryos are of good quality، وبعد انتظار يتم أخذ الامبريوز with a special catheter لإرجاعها إلى داخل اليوترس. نسمي هذا الامبريو ترانسفير. ويبدي بعدها نسميه luteal phase support ببروجستيرون، كأنه دا يصير simulation للناتشورال pregnancy من يصير إباضة والكوربس لوتيوم يبدي يعطينا البروجستيرون. and finally pregnancy test is done. احنا هذا الكلام كله حكينا عنه، راح أعلق لكم على الامبريو ترانسفير. قلنا إما من يصير insemination with a concentration of approximately 100,000 motile sperm per milliliter, and then they're incubated in a special medium with careful control of the pH, temperature, and the humidity. Traditionally, most embryos were transferred at day 2 after the egg collection, but now there is evidence that the transfer on day 5 achieve higher pregnancy rate. The regulations in the United Kingdom, for example, are to transfer 2 embryos for those who are less than 40 years of age, and if the female is more than 40 years of age, 3 embryos they can be transferred. يعني ليش؟ لأنه احنا جمعنا عدد من الفوليكلز، قد ينتج عندنا 6 or 5 embryos. ما معنى هذا انه انا اجيبهم كلهم واخليهم باليوترس، لانه كل ما زاد عدد الامبريوز، واحنا حكينا سابقا ممكن ازيد الكومبليكيشنز، المسكرج، البريتيرم ليبر، الماترنال كومبليكيشنز. بقية الامبريوز اللي حصلنا عليها راح they will be frozen طبعا and they can be transferred in subsequent cycle. شنو هذا الحكي معناه؟ يعني حناخذ الامبريوز الإضافية يتسوى لهم freezing، وفرضا انه هاي الاي في اف سايكل ما نجحت، بعد كم شهر ممكن انه we offer to the couple an IVF cycle، بس مو راح نعيد هالخطوات كلها من البداية، لا، راح ناخذ هاي الامبريوز نسوي لها ثاوينج يعني موعوها، وقسم من عندها طبعا ممكن يعني ترجع تكون قابلة للديفيجن بعد الثاني، قسم لا تفشل وتترجع بعد ذلك إلى الرحم. يعني راح نروح إلى خطوة الإمبريو ترانسفير. فلا تستغربون إنه يكون بيناتنا ناس من اللي هم اتجمدوا وترجعوا، هذا من باب الطرف بالآي في اف. luteal phase support، احنا we want to provide the endometrium with progesterone. شو راح نحصله؟ اما using HCG اللي هو يحفز لنا الكوربس لوتيوم، او مباشرة نستخدم بروجستيوجين او بروجستيرون at least for 2 weeks, and some centers of IVF they use it up to 12 weeks. Pregnancy test is done usually 12 days after the embryo transfer. Okay, and if the pregnancy test is positive, we offer ultrasound in 2 to 3 weeks to ensure that the pregnancy is intrauterine and viable. What about ICSI, which is the intracytoplasmic sperm injection? Here, individual morphologically normal sperm is immobilized by striking the tail and then injected into a mature oocyte. The indication: severe male factor infertility with the need for surgical sperm retrieval. فإذا احنا بدنا نسحب السبرم التستيكلز، فنحاول نستغلها بشكل كلش ممتاز. severe oligoasteroteratospermia. poor or total non-fertilization from previous IVF cycle اللي هو conventional IVF العادي نستفاد نسوي إكزي pre-implantation genetic diagnosis واللي حنحكي عليه. 40 to 5% of the total IVF cycles are done now using ICSI. With ICSI, there is a slight increase in the genetic abnormalities of the offspring. Most of them are minor, and the major congenital malformation rate is thought to be similar to that of the general population. egg donation طبعا احنا لازم ننوه لانه الايج donation والسبرم donation of course they are not accepted يعني religiously by most people لانه هو طبعا راح يكون biologically not identical لل parents. Indication ovarian failure, patient with very poor ovarian function, where previous IVF has failed, patient over the age of 45 with severe male factor disease, patient with hereditary genetic disease using patient's own gametes is not advisable لأنه معناتها حتكون هذه منقولة إلى الأوف سبرين. السبرم donation indication as a sperm carrier of severe genetic disease. What about surrogacy واللي طبعا البعض ممكن شاهد بعض الأفلام اللي تطرقت إلى هذا الموضوع. When the patient uterus is either absent or unable to maintain pregnancy يعني فرضا patient تعرضت إلى حادث أو أنه صارت rupture uterus وانتهت بستركتومي ما عندها living birth راح ناخذ surrogate mother اللي هي راح تكون post uterus it is used to carry the pregnancy يعني يسوي IVF والإمبريو الناتج ينقل إلى رحم وليس رحم الأم اللي هي البيولوجيكال mother. زين وهذول عادة باليوم patient who lost their uterus due to cancer or uncontrollable bleeding as PPH or in difficult myomectomy.
Pre-implantation genetic diagnosis. It is a form of very early prenatal diagnosis. الآن أثناء الحمل ممكن إنه نعمل سكرينينج للفيتس سواء كان عنده structural abnormality ممكن إنه نشخصها باستخدام فحص الألتراساوند أو ممكن إنه نشيك chromosomal genetic abnormality بسحب sample of the amniotic fluid أو أخذ عينة من خلايا المشيمة بالكولونيك فيلا sampling. pre-implantation genetic diagnosis هو فحص متقدم جدا الخلل الوراثي اللي ممكن انه يكون بالموجود بالجنين او اي genetic abnormality. الانديكيشنز شنو هي؟ طبعا احنا اللي راح نسوي وناخذ cells at the level of the embryo ونسوي لها study للجينز وللكاريوتايب. ممكن انه نستخدم هذا for single gene defects such as cystic fibrosis, thalassemia or sickle cell disease. يعني عائلة فرضا عندها أطفال اثنين يعانوا من ثلاسيميا ميجر ويضطرون إلى recurrent blood transfusion فما يريدون ينجبون طفل آخر بنفس المشكلة فيروحون يسوون IVF والإمبريو يدرس إذا كان يحمل نفس الخلل ولا لا. chromosomal rearrangement such as translocation إذا كانت العائلة عانت من chromosomally abnormal fetus يعني بيبي سابقا. HLA matching for donor sibling stem cells transplantation. لنفترض أن عائلة عندها طفل مصاب بأحد أمراض الدم ويحتاج إلى bone marrow transplant فاللي يتساوى أنه يعمل IVF وتدرس الإمبريوز ونشوف أي إمبريو هو HLA ماشت لهذا الطفل اللي يحتاج bone marrow transplant. عرفنا شلون؟ فيكون هذا الإمبريو مستقبلا هو الدونر لأخوه أو أخته. الcomplications of ART طبعا راح تكون هي الcomplications مالت الovulation induction، يضاف إلها الcomplications اللي تجي من البروسيجرز اللي نقوم بها أثناء الART. Multiple pregnancy 24% of patients they will have a twin when 2 to 3 embryos are transferred. Ectopic pregnancy, its risk is increased not only in patients with tubal disease, but it is thought to be due to post-embryo transfer uterine contraction that force the embryo into fallopian tubes. يعني بعد ما نخلي الامبريو باليوترس يصير contraction فممكن يندفع هذا الامبريو إلى مكان خارج اليوترين كافيتي ويكون ectopic pregnancy. Transvaginal oocyte retrieval complications، يعني احنا من نجي نسوي oocyte collection نستخدم invasive procedure، ممكن هذه تنتهي انه سوينا infection to the ovary causing ovarian abscess, or if damage to the bowel can occur if the bowel are adherent to the ovaries, or anatomy is disturbed, for example by previous adhesions. Ovarian hyperstimulation syndrome واللي تكلمنا عليه سابقا، واللي هو يعكس وجود excessive ovarian response. Usually it is mild to moderate, but if it is severe, it can be life-threatening, and it can end with thrombosis, ascites, pleural effusion. المانجمنت مالته تكون by hospital admission with careful monitoring of fluid balance، لأنه إذا أعطينا الكثير من الفلويد بدون ما نراقب هو they shift of the fluid to the third space، معناتها احنا نزيد الاسايتس والبلمونري edema. Human albumin solution may be given، لأنه بهاي الطريقة راح نزيد الانكوتيك pressure ونعوض الهايبوبروتينيميا. If ascites is present, we may need drainage, thromboprophylaxis by antithrombotic stockings and heparin. The subsequent pregnancy is usually uneventful, but rarely when the patient condition is deteriorating طبعا and not responding and her life is at risk, then pregnancy it may need to be terminated. Thank you very much.